and welcome. This is an overview of mood disorders by Dr. Latasha McElwain. This is just an overview of understanding what mood disorder is about for supervision. So, this is just an overview giving information that others may know, I may not know, but just a cool, straightforward presentation for mood disorder. So, overview of mood disorder. When we think about mood disorder, for the most part, it's a type of mental illness, of course, and it also impacts areas of emotional state. A lot of times when we think about emotional state, we have to think about whether we're happy, whether we're sad, whether we're both, or whether we're neither, or whether we're just content. There are a lot of emotional tendencies that come along with being extremely happy or being extremely sad. It's basically going through the different phases and getting to more intense levels. Most of the time, when we're talking about mood disorder, pretty much enduring emotions such as anger, irritation. There are also parts of several mood disorders that have a lot of these feelings and these emotions that get more intense or just kind of simmer down for the most part. But a lot of times it is causing a problem in your life. So we want to talk about mood disorder. Everyone typically has moods. So we want to think about it in terms of causing more concerns and more impairment in your life. And of course, we're talking about this for the purpose of my supervision is for mainly adolescents and young adults. So, but mood disorder, you can be diagnosed at any age with mood disorder for the most part. A lot of times we do consider when we're talking about adolescents and teens, we're talking about some of the fluctuation in hormones and things of that nature that we try to take into effect when we're talking about mood disorder. Some of the common mood disorders that we think about when we say mood disorders are major depressive disorder, disruptive mood dysregulation disorder, some of the persistent depressive disorders, sometimes called dysthymia, and then also some of the substance-induced moods that come along. Some of the prognosis when we talk about mood disorder depends on many factors. Some of the factors that we do consider is the type of condition and the severity. We also look at how early it's diagnosed, and we also look and make sure if there's that it's being properly treated, making sure that individuals are getting what they need in order to be able to manage these moods or get to a better state when it comes down to their mood disorder. For the most part, when we talk about diagnostic features of mood disorder, some of the things that we do see is the overall feelings and of sadness. We also see hopelessness, we see emptiness, and we see people being very irritable. We also know that pans out into some of our individuals feeling really, really depressed to the point of feeling like they want to harm themselves or harm other people. We also notice that there are diminishing interest in activities that they are usually, used to doing, and it was pleasurable. So now there's no interest to do those activities. We look at somatic changes as far as sleep disturbance, having issues with sleeping. When it comes down to the appetite changing, we also look at the lack of energy, having energy to do things. We look at body aches and pains. We also look at cognitive changes when we're talking about reducing the attention. We talk about whether they can concentrate or not. We also look at some of this executive dysfunctions, impairment in learning and memory. Sometimes that also causes some concerns when we're talking about mood disorder. Some of the causes that we like to make sure that we know contribute to mood disorder are sometimes biological factors. Sometimes there's some genetic factors as well. And sometimes there's some environmental factors. I tell people sometimes things that is experienced in certain environments could definitely cause some concerns when we're looking at mood disorder. So when we look at the biological factors, we're looking at some of the functioning of the brain, those cortexes in the brain that can have make those changes in how we manage our feelings, or we can in the brain, because those areas do help us with the change in our, emotions and things of that nature, a lot of times we have to be mindful that brain imaging studies have revealed that a lot of times there are concerns when it comes down to mood disorders. But a lot of times I do tell people also when it comes down to quote unquote brain imaging, there are, psychiatrists that could order those things through a neurologist in order to see kind of what's going on when it comes down to those biological factors and what's going on within the brain. A lot of times when individuals are coming in for therapy and psychiatry, for the most part, we're not going that deep, but we are finding out what's going on and what has happened, family wise, what has happened. Were there any brain injuries, any injuries at childbirth or anything like that, dealing with the brain, and any other concerns when it comes down to the biological family. We start talking about the genetics, strong family history. We start going into things like that. Increased risk for one developing mood disorder. Some of it could be very much probably and partially hereditary and genetic. So we do find out, if mom's dealt with depression, if dad's dealt with depression, if there's a history of depression in the family and things of that nature. We do go through a long biosocial assessment to ask questions and find out what's going on. When we're talking about environmental factors, we talk about the chronic stress. We talk about traumatic events that happen. We talk about stressful lives that people have to deal with every day. We talked about the death of a loved one. We talk about childhood maltreatment. We also speak about other things that go on earlier on in life and things that develop throughout life that helps to help this person to develop mood disorder, whether it happens early in life, later in life. Depression is one of those ones that we do look at. Chronic disease or chronic illnesses is another one that we realize that can be related to depression, as far as diabetes, Parkinson's disease, as well as heart disease. Sometimes when people realize they have something going on, someone may have cancer, that might, lead them to feeling a certain way about these chronic diseases. For the most part. Talking about treatment, when it comes down to mood disorder treatment, of course, I'm a therapist, and that's one of the reasons why I'm putting this out there, is because when we're talking about individual-based therapy and considering what's going on for an individual, depending on their disease, as well as considered on the symptoms, we have to think about what treatments would be helpful. A lot of times there is a course of treatment people go with which would be medication and psychotherapy. I have worked with plenty of people who just have done psychotherapy, which is talk therapy. So medication is not always a must, but it is a form of therapy that goes along with making sure that the brain is stimulated and things of that nature. So there are other forms of therapy that come along with, mood disorder that we have to consider as well. So when it comes to treatment, there are different levels of treatment that can be considered. We talk about medications. A lot of times we have to think about antidepressants, mood stabilizers, as well as antipsychotic medications as well. These medications help individuals be able to manage a bit better and cope a little bit better. When we're talking about treatment, psychotherapy, of course, we're talking about speaking and talking. Talk therapy is what psychotherapy is kind of related to what it is known as. And a lot of times we're doing talk therapy, there are a lot of different levels of therapeutic approaches that we come from. One of the big ones, CBT. We also look at some of the behavior therapy just to see kind of what's happening with how people are reacting to things. We also look at talking about some of the feelings that individuals are having, the attitudes they have, even their beliefs and their behaviors. So we work on those things and talk about altering them for the most part. So when we are working with patients, we want them to be able to recognize these behaviors, make a better choice as far as altering these behaviors. But we also are these feelings or these attitudes and beliefs and things of that nature as well. We also want them to figure out what would be best for them. A lot of times I have worked with individuals where it doesn't seem like the most best behavior to have, but the behavior that works for them and their family and their environment. okay. I'll work with those things and try to help them figure out, it might be appropriate or, considered appropriate at your home, but it might not be considered appropriate behavior to have outside of the home with other people. So moving right along, talking about more treatments, we're talking about common types of psychotherapies. And again, those are your cognitive behavior therapy, your dialectical behavior therapy, your psychodynamic therapy, a lot of different types of therapies that work along with making sure that a person is able to consider and, make a decision that is going to be the best decision for them in their environment, in their situation. So cognitive behavior therapy, a lot of times I do tell individuals when we're looking at CBT, we are looking a variety of issues or diagnoses can be considered when we're talking about cognitive behavior therapy. We're looking at depression, anxiety disorder, sometimes a lot of our alcohol and drug issues and concerns, a lot of the marital issues that people have, eating disorders, serious mental illnesses. A lot of times cognitive behavior therapy kicks right in and it shows up, and it has been effective in helping individuals to realize a lot of things they need to consider. It enhances their functioning. It also helps them with their quality of life. So there are many studies out there that let us know that CBT is very effective, which is amazing. But we also want to make sure that we are allowing individuals to, explore cognitive behavior therapy and also other types of psychological therapies that might be helpful, as well as psychiatric drugs that might be helpful for them. When we talk about dialectical behavior therapy, that's our DBT therapy. It is it's a modified form of cognitive behavior therapy. So with that, basically the main objective is to make sure that we are teaching people how to be present in what's going on, how to create healthy coping mechanisms for stress, and how to control their emotions and their feelings. Also, how to enhance interpersonal connections with other people or with themselves, for the most part, to make sure that they are effectively coping, effectively dealing, effectively handling their emotions, especially those intense emotions that come along with a lot of our patients. We talk about psychodynamic therapy. That's another one that focuses on the psychological causes of the emotional trauma. That's really getting into self reflection, self examination, being able to utilize the therapeutic alliance, and then also being able to work with different type of dysfunctional relationships and those patterns in those relationships. Also being able to basically have the patient be able to lead a healthier lifestyle and be able to understand how to resolve a lot of the visible symptoms that they have, how to focus on these things. So psychodynamics really do help individuals with mood disorder figure out what's the best policy for them. When we're talking about complications, we talk about basically if it's left untreated, we can think about individuals definitely with bipolar disorder can result into serious problems with the affect every day of your life. So it's going to affect different things that's going to cause problems. It's going to be problematic areas. And some of those problematic areas would be related to drug and alcohol use, suicide ideation or suicide attempts, wanting to harm yourself or harm someone else. When it comes down to legal and financial problems, damaged relationships, and then poor work and school performance. We also think about trying to encourage a more healthier lifestyle with home remedies. Some of these home remedies we can think of, and these are remedies you can get out in the community as well. Yoga, exercise, taking certain types of vitamins. That would be something to discuss with your primary care doctor, your psychiatrist. Meditation, going in for meditation, really trying to focus on how to do meditation on your own so you can be present. And then acupuncture is something else, another remedy that can be helpful when it comes down to mood. So when we're talking about mood disorder overall, the references are here that we have gotten all of the information that we've presented in this presentation about. But the biggest thing is to realize that when we're talking about mood disorder is that, it could be anyone from adults from children to adults, and depending on what's going on and a different kind of issues that come up in life and issues that we deal with overall in family or we deal with overall in school. We find a lot of our school students now having environments in school that's causing a lot of mood concerns because it's a lot to talk about. So with that being said, just wanted to give an overall of mood disorder so everyone have a cool, complete understanding of what goes on with mood disorder, having a great overview of mood disorder, and we kind of go from there. Any questions, of course, can be answered by making contact with me through my many ways of making contact, my email address, my websites, and things of that nature. So thank you so much for listening to this presentation on mood disorder.